So excited that you all are here and tuning in. We're talking about something that has been on my heart for quite a bit of time now. And in big part, it's something that we don't talk near enough about. As a pastor for 30 years, I have watched people get sick and go into the hospital. I've been honored to care for people as a pastor. But I have only seen one side of that. Behind the scenes, when people go to the hospital, there's a whole nother realm, there's a whole nother world that is taking place amongst the life of clinicians. And tonight, we're going to get to hear from two incredible ladies who have been there caring for people, working with people, loving on people, and helping people heal for all these years. So tonight, as we get to come in and listen to their stories, we're going to be talking about something that so many of us have been dealing with. It's the little things, from skin tags. Maybe we were just talking a minute before the show about hair starting to get thinner and falling out. Maybe it's a little joint pain. Maybe you're starting to have problems with the heart. Maybe you're putting on those extra pounds. Ultimately, it moves to more serious things. And we think many times it's because we're getting older, but a lot of times it has to do with something far more than that. And it has to do with things that are root causes that are not addressed. And that's the reality of metabolic health. So tonight, as we come in here, I get to introduce two, like I said, two incredible ladies for this unique show that we're doing tonight. And I'm so thankful that you're here. You may have questions as you listen to tonight's show, and that's great. Put them in the comments. If we don't get to them tonight, we don't have a particular time for Q&A. But if they're related, we're going to try to bring them out, and I will put them to them as we go through, because this is them on the stage, and I get to ask the questions. Guys, welcome to Behind the Scenes, Chronic Disease, Metabolic Health, and Your Health. And so tonight, we have Carolyn Byrd and Dr. Lauren Gagliano, and I want to start tonight. Carolyn, tell us a little bit about your role in the clinic as a clinician. What brought you into that? Tell us a little bit about your story.
Well, my story started 16 years ago when I was diagnosed with a very aggressive form of breast cancer. And at that time, they said I only had a 1 out of 5 chance of living past 5 years. So that when I figured out some things that was going on with me, and I'm like, I need to figure out what's going on with my body and not have this happen again. A lot of it was stress and, metabolically unhealthy. And so when I changed my lifestyle and habits, then I realized that, I was a hospice nurse, and I realized that people were dying from nutritional habits. So I became a health coach then, because I wanted to encourage and help people with their health. And it was weird, because it wasn't weird, but I came home and I quit my job as a hospice nurse, because I told my husband I didn't want to teach people how to die anymore. I want to teach them how to live. And so fast forward now, just a few years ago, I was starting to have some problems with my health again. And, working at a hair loss center. And I realized again that we are, having all these diseases in our bodies due to metabolic issues that are happening. And it just really got me, because I'm like, people are suffering. And we need to, once I found out how I was able to fix my health, then I knew that I had to open my mouth, do not be a gatekeeper, and make sure that I am sharing the gift of help and hope.
Now, how many years were you serving as a nurse before all this came about? Because we're going to delve more into that. But as a nurse, how many years, and where did you work? You did a lot of things.
Yeah, so I've been a nurse for 42 years. I literally supposedly retired about 5 years ago. But I've done hospital nursing. I've done home health. I've done hospice. I've been a breast health navigator, helping women navigate that once they were diagnosed with breast cancer, to help them navigate that, the system and their, and their disease. And so literally now, I tell people that ask me stuff, I say, I'm on the preventive side now. So when you ask me about drugs or whatever, I am on the preventive side. And like I say, now currently I am a health coach for a hair loss center, because one of the issues, metabolic issues, hair loss. Yeah.
Right. So Dr. Gagliano, before you got into this and started turning your attention over to metabolic health, tell us about your career as a dentist. What does that look like?
Well, I've been a dentist for over 30 years. And with my health journey, about 15 years ago, I was diagnosed with high blood pressure and cancer of the thyroid, and I had fibromyalgia, all those things, was put on medication, had a complete thyroidectomy, so I have no thyroid. And over the last 10, 15 years of being medicated for my blood pressure, it was getting to the point where it wasn't doing anything anymore, and I started developing other things. And 2 years ago, I was diagnosed that I was a pre-diabetic, and I actually saw that in my patients. I saw them coming in with more and more medications, and they were sicker and sicker, and there were things happening that I saw, but I couldn't explain. I knew they were related. And then when I started learning more about what metabolic syndrome was and what insulin resistance was, because Carolyn, I don't know about you, but I wasn't taught that in dental school. We were taught about insulin, of course, but insulin resistance, that wasn't even a thing. So when I started educating myself about what all this was, then I was not only able to help myself, like you said, help yourself so you could then help someone else.
Mm-hmm.
And that's a big part of it. And now, it's amazing the things that I see on this side of the spectrum when you're able to help someone and to get healthy, what your body can do.
All right.
Absolutely.
So let's delve into the clinic now a little bit. Let's go back to medical school. You brought that up, which is a great one, because those of us that never did there, that's kind of fascinating to hear about. Because we've seen the TV shows, right? We've watched all those. There's so much that goes in there. But Carolyn, when you were in medical school, when you were becoming a nurse, how did they teach you to define a healthy patient? What did that look like when you were going through school?
Pretty much it looked like somebody who, first of all, they weren't on any medications, for one. And so even when I was, in nursing school, usually when somebody got sick, it was an acute illness. So they would come into the hospital, they would get the proper medications, and they would go home. Fast forward now, people are chronically sick, and they have to go to the hospital. And unfortunately, they leave the hospital still being chronically ill. A lot of them are leaving sick, still on more medications.
Okay, help me understand that. Is there a cognitive dissonance that you feel with that?
Oh, absolutely. Being these 42 years, for one thing, our food supply has definitely changed. Sugar is everywhere.
Right.
And, even in pediatrics, if we had a child that was obese, we ran all kind of tests to figure it out, because you didn't see obese children back then. So
that's different than today, right?
Right. Except for today, our children are obese. But I didn't see an obese child back then. But like I said, if we had one to come in, we ran all kind of tests to figure out why was this child obese, because you didn't see that then.
Yep.
Wow.
More and more patients were coming in the clinic that were younger, being diagnosed with high blood pressure and type 2 diabetes. More.
Wow. Yes. And you almost never heard of children with type 2. They always had type 1 if they had diabetes, but not the adult illnesses. We wasn't seeing those.
Now, help me understand, because if I remember right, and Dr. G taught me this, there was another term for type 2 diabetes that you all were taught.
Yeah.
If I remember right, it was called sugar diabetes.
Sugar. That's right. And yes. They used to say, I got sugar.
Yeah. And
that's a Southern thing right there, right? That's a Southern thing.
Yes.
And it was also known as non-insulin dependent diabetes.
Wow.
And think about that.
Yeah, that's what I am. So why do you, we're going to get in the weeds right here. Why do you think they changed that?
Well, they didn't want it to be correlated to sugar. That's what I feel like. They didn't want that correlation, because sugar is in everything. Sugar is what's driving the issues with the inflammation. And so they did not want to put those two together so that people would stop eating sugar. And so that's the way I feel as the reason why they stopped calling it sugar diabetes. They didn't want to relate it to the sugar.
And they can also medicate for it.
All right.
Yeah.
Well, when did you guys, Dr. G, when did you first notice something was not right in your body? That you noticed that something was taking place that made you go, man, something's not right here.
Well, every time I would go in for my physical exam, every year, there'd be something more. There would be something else, everything. And then throughout the year, I'd have issues of things going on, but everything would look normal. Everything would look, but they weren't, they do a CBC, they do all the things, but they weren't doing one thing. And I didn't know enough back then to even ask them about what fasting insulin was. And I didn't even know exactly what insulin resistance was, like we talked about before. So I didn't know what to ask. Sometimes it's about really asking the right question, right?
Right.
So as things went on, and now I know that before you get that formal diagnosis of diabetes or hypertension or even, PCOS, something's going on behind the scenes 10, 15, 20 years, before you get, and little things are happening. Your body's screaming, or it's whispering long before it screams.
Yes. Yes. Absolutely.
Carolyn,
It's
what about
building
you?
up.
What did you see? What was it? What was the kind of the trigger for you that was like the starting to be going, man, something's not right here?
Yeah. Well, my first trigger was the hair loss.
Yeah.
And like I said, I'm working at the hair loss center, and then my hair started thinning out in the crown, and I'm like, something's not quite right. And then when I start getting the belly fat, because like I said, being on a health journey, being a health coach all these years, I was making sure, if you walk the walk, if you talk the talk, you got to walk the walk, right?
Right.
And so I was very particular about making sure, that, my weight stayed within range, and I wasn't, on medications, I'm exercising. But I still ended up with the hair loss. I still ended up, my cholesterol went up. And that was like, an awakening for me. And so, the belly fat, the hair loss, not sleeping at night, the brain fog. I had that when I had chemotherapy, and that was horrible. And I found myself in brain fog again. And I was like, Lord, something's wrong, because I've been doing everything that I thought was right for my body, but it's broken down. And literally, I didn't know about insulin resistance until 2 years ago. I didn't know about it.
Well,
Yeah.
okay,
Yes.
so let's delve into this a second. At what point, how close did you get to accepting this as normal?
I didn't.
I didn't. I knew there had to be a reason.
Y'all said that
But
at
I
the
didn't know
same
what it
time.
was.
Wow. Y'all jumped on that one. Wow.
Yeah.
Go ahead,
Yeah.
Carolyn. I'm sorry.
Yeah, I knew it was a reason because I knew I was doing everything that I was supposed to do that was right, but I knew it had to be something else that was causing me to go have these issues because I had been fine all this time. Like I said, I wasn't on medications except for I have a condition called supraventricular tachycardia. My heart goes too fast, so I take a beta blocker every now and then. But really, I wasn't on any medication, so I just couldn't figure out why my body was starting to break down. And then, when I learned about insulin resistance and also with menopause, when you go through menopause with a low estrogen, it also predisposes you to insulin resistance. And I was like, wow.
Okay. Dr. G, what about you? What was it for you there?
Well, I was doing all the right things, so I thought, but I was still feeling bad. But all my labs were fine. Everything was great. And I was like, something's wrong. No, you're good. You're good. And that's why I wouldn't accept it. I was just like, nope, I'm not going to accept that. Something's wrong. I need to figure this out. And then sure enough, it wasn't long after that I got the diagnosis of prediabetes, which in a way I think that's worse than diabetes.
Yeah. Oh, yeah.
Okay.
Oh, yeah. I think so too.
We have to think about that one. That's going to be a question for a different time because I wanted to go a little bit different route. Let's kind of tackle this a little bit second. As you think about your time in the clinic, now that it's kind of maybe a little bit in hindsight, Carolyn, Dr. G, I know more recent, what patterns, when you think back about this, did you see repeating in the people that you cared for? What were some of the things that were just kind of like, as you think back, or even now, because people I know always are going to ask questions. You go to church and know, oh, you're a doctor. Can you answer this question for you? You're a nurse. Can you tell me that, But what are some of those patterns that keep showing up?
Well, one thing with the women at the hair loss center, we saw a lot of gut issues. They were having problems with their gut. They were having, a lot of them had autoimmune disease. A lot of them had, they were overweight. So we were
Mm.
starting to see all these common denominators too, that was with the hair loss. So we really knew that there was some inflammation going on in the body, which was causing their immune system to be weak. And now they were open up for all kind of diseases. And so that's really, we treat the whole woman, the mind, the body, and the spirit. So not only was we, talking to them about nutrition, but exercise, stress management, and also sleeping. So those are the things that we were teaching, because we realized that they really was metabolically unhealthy. When we figured, when we put all the pieces of the puzzle together, we were like, oh my goodness.
There's
Yeah.
more. There's more. Now, Dr. G, being that you're a dentist, now that's going to be a little bit different, but what were you seeing? Because there's some things that I know you can unpack that are pretty impressive, but what did you see?
Well, a lot of patients were coming in with, caries, decay all the time. And it was recurrent, meaning they would get it on the same tooth over and over again. But more importantly, progressive periodontal disease, that it just would not get under control. Inflammation would be, a big part of that. And they would be doing, again, they would think they would be doing all the right things. They would be listening to what the protocols were that we were to follow in the dental office about how to, get back on track. And there were some patients that healed just fine, and other patients where it was a struggle. It was a challenge. But then even when those patients were, they go into, their healing phase, they would all of a sudden one time they'd come back and it would be inflamed again. And so it was management that was very frustrating, not only for my patients, but for me, because until I learned what insulin resistance was, then I could educate them better.
Awesome.
Yeah.
So I want to welcome folks as you guys are coming in. This is really, I know people are leaving comments, and I thank y'all for that. If you got questions, as you listen to it, as I said earlier, we'll get to those, and I'll throw these out to them if you've got some as the ladies are talking tonight, disease, but we want to welcome everybody in here tonight, being that this is online. We're thankful that you're here. And if you do need to reach out, you can definitely reach out to us here, whether that's on YouTube or whether that's on Facebook. Put the comments in, and we'd love to see where people are coming in from. And we thank you so much for being there. So let's kind of delve in as we continue kind of this thing.
One question.
Yes,
Let me
ma'am.
ask you one thing. Everybody's keep messaging me and say they can't find us on Facebook. So I
was not able to share it. I wanted to say that early, and
yes.
Oh my!
I couldn't find it either.
Okay.
I was
I'm
not.
All right. Let's see. Is it not streaming?
I was not. It wasn't on live on your page. I will say.
Oh my! I apologize. My goodness. It should have been there. I don't know what happened.
Let me
No, it's
pull it
not
up.
streaming. Y'all give me just a second. I'm glad some of y'all are finding your way in over on YouTube.
Yeah, I just told some people go to YouTube. So
good.
Yeah.
Good. It says it's streaming. I'm gonna switch off and switch back on and see if I make that toggle real quick. I don't know why that's doing that. I apologize.
I think let's see.
There. Now it's showing.
Okay, I'm going to give it a minute.
Yep,
Yeah.
give it just a second. So those of y'all that are catching this now, if you're coming in at this point on Facebook, know that the first part of our recording tonight is going to be over on YouTube, and you'll want to go catch that. So go over to Healthy Together AK, at Healthy Together AK on YouTube. So I'm so glad that folks have come in and have made it. Yes, thank y'all so very much. Those of y'all that are coming in over on Facebook. Yeah, I was wondering, I didn't see any comments coming in. So so catch the first part about this, but you'll be just fine. So we were talking about what is it that, and this is actually a great segue. We're talking about what these clinicians were seeing in patients. and asking those questions. What were they seeing over and over again in the patients that they were looking at? What were the patterns? So, and Dr. G, I want to kind of tackle this just a second. From your perspective, how connected is oral health and metabolic health? Now, you can speak to this. No one else can. There's just not anybody.
Well, that's a very good question, because what do we think about when we think of our mouth as just teeth, right? Well, it's a lot more than that. You better believe that your oral health is definitely connected with your systemic health. And just like we have a gut microbiome, we have an oral microbiome. And if it's in dysbiosis, we're having some issues. And believe it or not, dentists can tell if of systemic disease long before your PCP, your primary care provider, gives you that formal diagnosis of diabetes or high blood pressure or cholesterol, high cholesterol. We can tell just by the inflammation that's going on in your mouth.
Okay, now help me understand this. So you're telling me and everybody on here that is a dentist, you can see what's going on basically with my heart if there's an issue, with Alzheimer's, with diabetes. You can see that.
I can't see directly in there, but what I'm saying is, judging by the condition of your oral microbiome, I can tell that there's something systemic going on, and that I recommend you need to go back to your provider. They need to do these tests. They need to test for this. And more often than not, we'll start with, doing a CBC and getting a complete blood panel with checking your A1C. And more often than not, those patients would come back to me and say, how did you know I was a diabetic? And I said, I could see it. Something more was going on than just it's a different type of inflammation, things that don't heal. When you're a diabetic, you're immunocompromised. And so they take a long time to heal, and your mouth is one of them. And if it's a repetitive thing over and over again for a long period of time, a chronic systemic thing going on, there's more than just, you have to brush your teeth. It's more than that.
Yes. Wow.
My goodness. So, how many times would you say that patients looked fine on paper but weren't fine?
All the time.
All the time. Carolyn, what about you?
Yes, all the time. I mean,
was there something that was like a particular thing that you would see, or was it something that they said that was like, I just don't feel right? I'm on the, what was kind of the giveaway that, paper said it was fine?
a lot of times, a lot of people come in, they say their stomach's hurting. You know what I'm saying? Their stomach's bothering them, or they just know something's wrong, but they can't put their finger on it. They just not sure. They feel off.
Right.
Yeah, that's that that land of frustration that Dr. Tiff talks about, because we can't really see what's going on. We can't really pinpoint it, but something's going on.
Yes.
That's why it's so important to also listen to your patients. They know a lot, and with what's going on with them. They live with their bodies 24/7, 365. It is really important.
Right.
Listen to your patients too.
Yeah. And we're told that all the time, because sometimes you can have a preconceived notion of what's going on with the patient, but you got to really listen to what they're saying in order to, to be able to diagnose really what is going on with them.
Yep.
All right. So these are two questions that I've really they've been in my head. So y'all get ready for these. All right. And I've thought of for each of you specifically. So Carolyn, were there moments where you questioned the protocols that you were expected to follow as a nurse, from where you learned from school, and you were given protocols? You couldn't question them.
Yeah.
But in your head, in your heart, did that come out?
Yes. So when a patient would go into the hospital and they would be diabetic, I couldn't figure out why they were feeding them mashed potatoes. They were feeding them sweet tea. They had the bread, the white bread. Then they would come in and check their blood sugar. Of course, it would be high from all the carbohydrates. And then they would go back and go give them an insulin shot to bring their sugar down. That was...
Why does that make you question? Why did that make you question?
Because, when we talk about diabetes, one of the things you tell them, leave the sugar alone, concentrated sweets, leave that alone. And for them to come in a hospital, a place that's supposed to help you heal, and they're actually giving you something that is making your issue worse. And then to come in and medicate you after that, really, they did that to you. They caused your blood sugar to go up. And now they're coming in to give you a pharmaceutical. They're coming in to give you a shot to bring it down. And a lot of them say, I've never been on insulin before. Why would they come give me a shot? They just jacked your sugar up.
I always questioned, why are we treating both type 1 and type 2 diabetes the same by giving insulin? And it did make sense to me, because one is a dietary disease, one is a lack of insulin. That's type 1.
When did you start? When did you start questioning that,
Well,
Dr. Gagliano?
I questioned it in dental school, and the answer.
Seriously?
Yes, and the answer I got didn't make sense to me. I couldn't understand how that worked. If you were already high in insulin, why are you giving more insulin? It doesn't make sense to me. It never made sense. And the answer I got in dental school, and believe me, I respect my professors. I mean,
I was about to go there, but you go ahead.
They were like, that's how we've always done it. And for me, that's not a good enough answer. We need to figure out what we can do better.
Yes.
And and now we know that one of the things that we shouldn't be doing is giving a type 2 diabetic insulin. I mean, there's better ways. I mean, that's like the.
Okay. Wow. So do you think that your peers would call this nonsense? I mean, what are they not understanding? I mean, you guys are talking stuff that, like, protocol has been these things, but you guys are going, I know, look at y'all. Yeah. But you're, what are they misunderstanding here? Which one of y'all wants to talk about
this one first? I believe in furthering your education. If it's something you don't understand, get educated further in it. And if it's something that you question, the same thing. And do your own research. That's what I did, because I didn't understand it. And I wanted to understand it. And it made me a better clinician. It made me a better doctor. It made me a better person. I was able to help more people. I'm still able to help more people on this side of things.
Right. Yes. And that's one reason why I left the workplace, because then I started my own business, because I didn't have to be bound by things that I know was detrimental to my clients.
Yep.
And so I knew that when I started my own business, health and wellness, that I would be able to educate them, because that's so important to be able to educate them on what's going on with their bodies. Because if you don't educate them, and then when you help them with the solution, they'll pretty much understand why the solution will work for them if they understand why they're sick in the first place. So I'm big on educating first, before just saying, you got to take this. No, you need to understand why you take it. And a lot of times they understand why they're taking some, they're more apt to stay with the program.
Ooh, that's a great question. So if someone's watching this right now, what symptom would you tell them that they need to listen for that would really make them pay attention? If there was one thing, as we're about to, because we're really kind of getting into that turning point for your lives, but if somebody's listening, what would be the symptom that you would say above all others you need to pay attention to?
Inflammation, hands down.
Yes. Inflammation. Absolutely. And then, and the gut health.
Oh yeah.
The gut health. Yes. Okay. If your gut's not
help me understand, why is that so important? Y'all are in unison there on that again. It was like,
with your gut health, that you're eating, all this is your gut. It starts from what you put in your mouth all the way down. And so when that's not working right, it's going to affect your whole body. And we've been talking about the over 90% of our serotonin, which is our happy hormone, is made in our gut. Our gut is our second brain.
Yep.
And when that's not working, we're having people being anxious and depressed for no reason at all, because their gut. And, like I said, 80% of the food that we eat today wasn't here 100 years ago. We're eating fake food. We don't know what we're eating.
Holy wow.
And so we're eating, and I'm just going to go back because I'm spiritual. I just feel like God designed our bodies to take in food, not chemicals. So when we're putting chemicals in the body doesn't recognize it, so it's fighting it to get rid of it. And so as that fight is inflammation, you feel like your body is on fire. And so that's where it really starts. But, when you go to your provider and you know, they tell you have inflammation, they're going to give you a pill,
Pill
you
for
know, because
Right.
they're going to treat your symptoms. They're not treating the root cause. And I talk about this all the time. When your gas light come on your car, you're not going to put a Band-Aid over it. Because if you put a Band-Aid over it and ignore it, your car's going to run out of gas because you didn't address the root cause of why the car light came on. It's
Right.
because you needed gas. Same thing with your body. If you keep putting Band-Aids, your body's going to break down because you didn't address the root cause of the problem that you're having.
Yeah.
Right. So, all right. So let's get a little bit more personal now. So what was the turning point that pushed you to start to look outside the normal approach to medicine? What was the thing that really pushed you to say, this just doesn't feel right. It doesn't add up.
Ooh.
I got you on that. All right. I'm doing my job.
I think that for me, seeing how, because like I said, I wasn't on medications, but seeing those women and men coming into the hair loss center, and they were on tons of medications, but they were still sick. And I'm like, this is not a fix. And so when I started, you know, noticing, like I said, my hair loss, the thinning, you know, was one of the first ones. And, you know, things that I would teaching clients prior to me learning about, you know, the protocol, I had to undo everything, you know, and then I started understanding more about the importance of high protein, you know, high fat, you know, meals. And so, but that was really, you know, the common denominator, seeing all these women and men coming into the hair loss clinic with their hair loss, but they also were usually on a ton of medications as well.
And in addition to that, no one was getting better, and they prescribed more and more. And it was a younger population. That's what got me.
Wow.
A population was now being medicated for things that were not being medicated or even diagnosed years ago. Even when I graduated from dental school here, I mean, we didn't see what we see now. That was a turning point, big time.
Be more specific. What did you not see? I mean, just the young ages, but were there the conditions in the young ages? What was it?
Conditions that were being treated. Type 2 diabetes, we never heard of that. And it was in older generations. You heard your aunties or your grandmothers had it, not 22-year-olds or even 15-year-olds. Hypertension, that wasn't a childhood disease. Obesity was not. We never saw I don't remember seeing those things. And even when I got out of dental school, I don't remember seeing those things. And now they're being medicated. Everyone's on a statin. Everyone's on a statin because the guidelines were changed. So it's those things that I paid attention to, and I couldn't figure it out for the longest time.
What shocked you about dental work? What were the changes there with those? I mean, I'm assuming that the ages were impacting there. What was, I mean, because again, we don't really hear about dental in this, and you kind of opened a lot of people's eyes.
The dental work, a lot of, you know, recurrent decay was a big thing. Basically, you keep getting cavities over the same, you know, with the same tooth that you just had fixed recently. A buildup of, that happens a lot. And it's tied into your diet. It's tied into what we're eating. It's tied into your systemic health. It's tied in how your body is processing all these things. And if you don't have a healthy oral health, you do not have a healthy systemic. You just don't.
Okay, now again, we're kind of getting a little bit more personal here because this was real. You guys have shared a little bit about how this was hitting you and you were seeing it in patients. But here's the thing. When you decide to make decisions about changing your life and protocols, and we're going to talk a little bit more about the specifics of that, but how long did it take before you started to see real changes in your body? When you started to say, I'm going to get metabolically healthy, but y'all are both smiling like Cheshire cats over there. My word, what is going on? What was it that was just like, oh, this is changing? How long did that take?
I saw a reduction in chronic pain and an elimination of inflammation in 1 week.
Really?
Yep.
Wow.
1 week. Wow. And then now, 2 years, you know, fast forward 2 years, there are more things going on that I didn't even know were issues, that I look back and go, oh, wow, I don't have that anymore. You know, I don't, it's just amazing how things, when you allow and give your body a chance to heal itself and the proper tools to do it, it's amazing what can happen. Your body wants to be in homeostasis. It doesn't want to be in a constant form of chaos. It just doesn't want to. And it reacts to that. You know, it reacts to starting, you know, hair falling out that you were talking about, Carolyn, skin tags, migraines, all the things. You know, it's trying to tell you something.
Right.
And the opportunity to correct itself, it's a beautiful thing.
Yes.
Carolyn, what about you? What was the...
Well, I realized that, you know, the sugar addiction was gone. You know, the constantly food noise. The first day I drank the tea and I'm looking around like, why am I not hungry? You know, and then the first week I lost 5 pounds. I had been trying to lose that 5 pounds for 2 years. And all of a sudden, the first week I lose 5 pounds. Wow. And I have, you know, spinal stenosis. So I needed to clean my house. Usually I have to pre-medicate with Motrin. And I kept saying, I need to go take the Motrin. I kept saying it, but I forgot. And I realized I'm not in pain. I don't have that numbness and tingling in that back and hip pain now. And I was just like, wow. I mean, that was better than anything is to come off of Motrin. Because again, that's a Band-Aid and it has side effects, you know, with your tummy, with your kidneys. And I knew I couldn't stay on that medication long term. And so to be out of pain is just amazing thing, because pain is debilitating, pain is depressing. And I was so happy to stop taking the pain medications. I feel like I had my life back finally.
Oh, that's such a great thing to hear. I mean, it's so hopeful for people. So how did this change? And this is something that you've kind of hit on it a couple times. How did this change how you viewed food and insulin? And that's a big key here, is the two of those together, where, you know, we talked about the misunderstanding, I think, you know, as I've looked into this, that misunderstanding about food and insulin, we've kind of kept those, but I think we've got some signs that things are changing there. Carolyn, what about you? Let's start where you were. How did that change your perspective on food and insulin?
Well, you know, for a long time, you know, I was plant-based and vegan because of the fact that been a cancer survivor. And I was really scared, actually, that the cancer would come back if I start eating the meat, if I started doing, you know, the dairy and all that, you know, because literally when I took all that out of my body did change. But doing all those things, later on, as I started getting into those low estrogen menopause symptoms, I noticed, you know, like I said, the belly fat and all of that. So when I was told, you know, when I started the protocol, you know, beneficial to get a lot of your protein in, whether it's animal protein or plant-based protein. Well, I decided, you know what, I'm going to try more of the animal protein and see what happens. And literally, my husband talks about me all the time. He laughs. He says, she's really eating a lot now. You know, I think I'm making up for lost time. Now I eat the high protein, high fat, and low carb, because, you know, and the fact that I don't have to be on a diet, you know, I don't have to count you know, I don't have to count my carbohydrates. I don't have to count anything, you know, and it's just been so easy for me. But before, you know, I was drinking a smoothie and having a salad, you know, it was very depressing. Now I'm really enjoying food and having food freedom, which is something I hadn't had in 16 years.
Wow.
Yes.
Wow. Dr. G, what about you? I mean, because you've had to see the effects of food right up here in the mouth all the time. People that didn't brush and floss the way they should. I can't even imagine what you have to look at there. But how did this change? How did this change how you looked at it?
You know, once I realized and understood how our food is processed, 3 different macros, fats, proteins, and carbohydrates, how and where they're processed in your body, how that works and what elicits a glucose spike, then I began to understand what it's doing to my body. And, you know, just like Carolyn said, I began to focus on more protein and fiber. So then that way
Mhm.
I can then get my body into metabolic flexibility.
Mhm.
And, you know, and intermittent fasting, we also do that. But, you know, as far as with food and insulin, they go hand in hand. And once you realize what foods are eliciting a glucose spike, because it's different for everybody, then you can begin to understand how your body is working and getting back into hemostasis.
Mhm.
Okay. So what I'm hearing, we're going to make a little transition here once again, because what I'm hearing, I think, is that there's something more to this than what people realize. When we talk about a protocol, this is not a fad diet. You guys have kind of mentioned we're not doing a fad thing. Carolyn, you talked about being vegetarian, vegan, and going through that and realizing that really wasn't the end all to things. And that really that food freedom Dr. G talks about is kind of opens up that perspective of things, that there's a lifestyle here. There's more principles that are involved in this. And I think there's some non-negotiables really too that come into this. But this protocol, we just kind of want to look at those core principles. When you guys have mentioned this, and we brought this up, and some folks that have been on here maybe have heard us talk about this. I want to talk a little bit, because while we're not giving medicine advice, this is science-based. You're listening to two clinicians who have got their education and have continued. Because look, I live in the house with a doctor here who has got to do her continuing education. I listen in and I'm going, holy cow, I'm learning too.
Yes.
Right. And I know, Carolyn, you've had to go through that. You don't get to do what you do without staying on top of it.
That's right. Lifelong learner. Because things change, things evolve. So we have to be lifelong learners to stay ahead of the curve, to understand what is really going on. Like I said, what I used to teach my clients, that's not how I teach them now, as far as their habits. So
let's get into that here. I'm really intrigued by this. As you guys look, I really am fascinated. I know things about this, but I want to hear it from you all. I mean, what would you say when you look at the core principles of this protocol? You name whatever you want to name. What is core to this at its core when you think about this system? Carolyn, what's the core to this for you as somebody as a clinician?
Keeping your insulin levels low. Keeping those insulin levels low. And like I said, I had to teach differently, because I used to teach eating your fruit first. And that was jacking your sugar right up. I don't teach that anymore. I teach you to eat your fruit at the end of your meal now, to keep your insulin, keep your insulin levels low. Like I said before, 2 years ago, I didn't know that. So I had been teaching in a way where I was taught then, but now that we know, especially since we're seeing so many people that's metabolically unhealthy, to teach them the right way, the right order of your foods. And that was a game changer.
Yeah.
Right. Yeah. Dr. G, what about you, Dr. Gagliano?
Unimate, definitely fiber, our balance. And it's not just one form of fiber. Like Carolyn said, it's, fruit is good, but it's not something you want to start with. You want to start with some good fiber. We have balance of 7 soluble and insoluble fiber matrix that helps to coat your digestive system, coat your food, so that you have better absorption of those carbohydrates, better metabolism of your food. And then intermittent fasting. That is one of the only ways to bring down your insulin. It's essential for that insulin level to come down. We are not meant to eat every 2 to 3 hours. It's not going to rev up your metabolism. It is not going to be good for you. No. You're swimming in insulin. You're swimming in glucose.
Yes.
That happens. And so those 3 things will help you understand what metabolic flexibility is, because you're giving your body that other opportunity to tap into that other foods, that fuel source, and then it will allow you to become metabolically flexible and not metabolically sick anymore, and heal yourself.
That's right. That's right.
Dr. G, you guys mentioned a short period of time, a lot. Now you mentioned the T, the Unimate, and the balance. So you mentioned those 2 things. Now, as I understand it, that is something that is, I know there's questions about this, so I want to make sure we understand this. This Unimate and balance, we find this in the provider's digital reference. Did that surprise you as clinicians that there was something that was natural that was in the provider's digital reference? Did that surprise you at all?
Yeah.
Yes.
Yes.
Okay. Again, I love it when you guys just are like in sync with it. Why? I mean, help me understand. I mean, it's the provider's digital reference. We understand that really is about medication, but that as clinicians, and I know, it's different. I know Dr. Gagliano, you're a prescriber. I mean, you handle this, and then, Carolyn, you have to make sure it gets to the patients correctly and the correct dose and those kind of things.
Right. Mm-hmm.
Help those that are listening to this. Why did this strike you as, this makes sense? What was it about this tea and the fiber in the PDR that just went, of course?
I think, go ahead.
Oh, I was going to say, one of the things that I liked about it, there's many things. One of the things is that it's working at the cellular level. It's working to address the root cause. There's no side effects.
Mm-hmm.
With medications, you have side effects. Regardless, there's going to be a side effect. And you don't know which one you're going to get. And medications only manage your symptoms. This heals at the cellular level. This helps to address the root cause causing all these problems in the first place, and that is insulin resistance. That's what it goes after, and it addresses that, so that all these things that we talked about, you had mentioned, Carolyn, that you go to the doctor, you're going to get a pill for everything you have, and all of these is, we can trace this back to one thing, and that is insulin resistance. And you won't have to be medicated for every single little thing.
That's right. I mean, that's even like people, when you talk to them and they're looking for answers. So they have a cabinet full of herbs. They got an herb for this, they got an herb for that, and they can't keep up with that lifestyle. And that's why this here
it feels like medication.
Say that again.
It sounds like pharmaceuticals.
Yes, but they know they need herbs. They know they need, so they got all this here. I actually went to a house tonight and they said, well, how about this for my gut? How about this? I was like, you know what? I got one thing to fix all of that, So you ain't even have to think about it. So yeah, I mean, we're searching. We know that there should be something out there to help us. And so we're constantly searching. That's why we're so excited that this is a one-stop shop now, when you like.
Do you think that this is the answer? I mean, I'm just point blank. I mean, people that are coming in here, do you think this is the answer for metabolic health to support people?
Oh, absolutely. The science, you got to follow the science. And we, as medical professionals, we look at the science and not just looking at the science, but when you have so many people coming back and now they're metabolic, flexibility, flexible. And we're seeing that, it was like, okay, this has been the missing link for what we have needed all of this time that we didn't even know we needed it, So I'm just thankful that we, I tell people, I'm so grateful that we get to help others. I'm so grateful that we get to introduce others to this product who has helped so many people. And like I said, people are searching. They're sick and tired of being sick and tired. And they want answers, and they go to the professionals and they're still sick. Yep. And so we're so excited that I think it's the end all. I really do.
And I've never seen the results with anything else out there like I have seen with this system and this protocol. And there's other things out there, and that's fine. It's like what you said. I have one thing that'll take care of all that. And it's, you don't have to mix, 15 things. You don't have to take, and remember, for me, it's remembering to take all that stuff.
Yes.
Right.
One thing. And the results are measurable. We have those results, and you can get those results, So.
Yeah. All right, now, Dr. Gagliano, this is directly for you because, you are a prescriber. You have to go through all of the rigor of being able to prescribe, and you can prescribe some pretty intensive pain medications. You're qualified to handle some things not all providers can do. So let me ask you this question. Why do you think that other clinicians are hesitant to prescribe or to recommend this to patients when it's sitting there in their own reference book? Why do you think that they're hesitant to do that?
I think it's goes back to education. I think they need to do their research. I did mine, and find out what this is and how this works and what it's doing. For me, I always looked at my patients and I would always tell them, it's my job as a clinician and healthcare provider to help you not need me, not be dependent on me. Because if I've done that, then I've done my job.
Yes.
And, you know, if medications were working, we wouldn't need a refill. I mean, we would. There's a time and a place for antibiotics. Don't get me wrong. Not anti-drug. Okay.
Yes.
Time and place. But you don't take antibiotics like, you know, they're not prescribed like a statin is prescribed. And if statins were working, why is that the number one problem that is the number one cause of death, cardiovascular disease, that we're looking at? So it's about education. I think it goes back to education.
Right.
And it's listening to your patients also, listening to what they're telling you. You know, if something's not working, it's not in their mind. It's not, you know, because they're not doing it. You need to pay attention to that.
Okay. So we're getting down to our last 10 minutes. So I've got some really pointed questions here. We've talked about the protocol. So, and people understand that this Unimate and this balance is something that they can purchase. They can do this on their own. All right. Certainly, if you are with a under the care of a physician, definitely, Dr. Gagliano, you would recommend. I think. Absolutely. I don't want to assume, but I think that they talk to their doctors. Nothing wrong about that. Carolyn, you would do the same thing as a health coach. Absolutely, you want to do that. Okay. So if it is something that would work for people, I'm going to ask this one, Dr. G. Who is this not a good fit for? Who is this approach not a good fit for? Carolyn, you think about the same thing, and you guys might be on the same page. I don't know. Is it not a good fit for some people, or should everybody be?
Well, I always like to say it's not a miracle. It is a nutraceutical. Just like you would be given a prescription by your doctor, you have to take it. So if you are not going to use it and you're not going to use it, you know, every day, it's not going to give you the results that you're expecting or wanting. So you need to find out your why. You need to find out what you want and how you want to go about it. And if you are wanting to heal yourself naturally without medications, then this is something for you. But you have to be consistent about it. You have to be consistent about it.
Well said. Exactly. Have to be consistent and change your mindset. You have to change your mindset because, you know, a lot of people just think that they're going to stay stuck in that same situation because they've tried everything and nothing has worked. And so they're a little skeptical, like, why should I believe this is going to work? You know, I think the beauty of it, too, is your 90-day money back guarantee. So what do you have to lose? You know, because it's guaranteed, you know, if you don't get the results that you desire, then it's guaranteed. So you don't have anything, you know, you don't have anything to lose. But just think about, suppose, you know, you have more to gain. So suppose you tried it and it worked, you know? And so it's so important. You got to change the mindset because our mindset is a problem sometimes. We just don't think, we think we're stuck because we've tried everything and nothing's worked.
Yeah.
Isn't that the truth? And that's a good question. That's a good segue. Dr. G, what would you say to the clinician watching this who feels that they're boxed in? What would you say to that clinician that feels like they don't have any opportunities to do anything different?
I would say that's your own symptom of the system, that you're not able to, you know, treat your patients the way that you would want to. And if that's what, you know, if that's what you're, you know, determining what boxed in is, I would say, again, you need to listen to your patients. You need to establish a relationship with your patients, listen to what they're wanting, listen to what they're asking for, and maybe going outside those protocols and looking into. That's why we have functional medicine now. I mean, because people are looking for something. They're looking. That's why they have a medicine cabinet full of all these herbs and all these supplements and things.
Yes.
So if you are a clinician and you feel boxed in, educate yourself to know there is something else and there are other options out there to help your patients, and listen to them.
Wow. Carolyn, what would you say to a patient who feels that they're tired of being told everything looks normal?
Well, I always tell them, don't give up, because you know your body better than anybody else. So keep searching until you find the right one that can let you know there's something absolutely wrong with you, because you know better, you know your body better than anybody else. And I always tell them, I give them hope, to say, our bodies are designed to heal itself out if we give it the tools that it needs. So I just keep encouraging them to not give up, that there's something's wrong and something's wrong. So don't give up. Keep searching, and hopefully you'll find somebody like us that can help put you on the right path of healing, hope and healing.
Well, ladies, y'all have been incredible tonight. I mean, the comments that I get to see, I'm not sure what's over on Facebook. I'm getting a lot of stuff on YouTube, on Facebook, but we have had quite the audience. I've been watching people coming in and staying and been here. There are so many more questions that I want to ask that you have brought up, even though I have this bank, but I know that our time is coming to an end. So I do want to let people know, if you are wanting to go more, if you've got questions, if you were invited here by somebody in particular tonight, whether that was somebody on this call, whether it was me, whether it was Carolyn, whether it was Dr. G, or anybody else, and you want to go deeper, you want to know more, reach out to the person that invited you. If you happen to stumble upon this, and maybe you were on YouTube or Facebook, whosever site you find this on, reach out to that person. You're there because we care and we want to help. That's why we do what we do. And I'm going to ask this. This was the first episode of this that we have done. And if you have found this to be educational and helpful, please give us some feedback. We'd love to know that. If you want to see more of this, I've got a couple of other clinicians that are lined up, ready to come. If you're finding this to be helpful, hearing from different people in this field that are doing and healing. But these two products that we have heard about tonight are game changing. There's no question about it. And your health matters more than anything. I would hope that you guys that were here, that you all would thank the Protocol Works. There we go. I'm going to post that one right up here. We're going to put that one right on the screen. Thank you so very much. Somebody, I don't even know who this is.
I do.
People, you know who this is. All right. But there's people here I know that are going to check this out and see this. Ladies, if there is something that you would want to say as kind of I always like to use the parting shot. I don't know where that came in my mind. If there was a parting shot, you got one sentence. You can't do any more than that. I know you all can go all day long. Y'all have done lives. You've done lectures. You got one sentence. What would be your parting shot to the people that are here watching that might be stumbling across this? What would you tell them today? Carolyn, you go first.
I would say to them, don't wait until something breaks before you start getting help, because you may go to that doctor's appointment and receive bad news, and nobody wants to receive bad news. So don't wait until something breaks. Be proactive with your health.
Awesome.
I'm going to say the same thing. Advocate for yourself. Be proactive about your own health, because it's easier to address it now than when you get that formal diagnosis later, because then you're backtracking, and then more things are going to happen.
Yes.
Awesome. Such great information. Thank you, ladies. Carolyn, Dr. Gagliano, thank y'all for being on tonight's live and being a part of this. It was absolutely a joy to have you on. And as I say to everybody that's tuned in today, go get the day, make it golden, go be excellent to one another, live the golden rule, but don't forget to be excellent to yourself. Y'all have a blessed night, and we'll see you back around the next time we go live. Pay attention and make sure you subscribe and follow all three of us on all the platforms you can find us. Y'all have a great night.
Thanks.
Good night. Thank you all so much.
It was great.